In this edition of America's Hope News, we travel to the University of Illinois at Chicago to interview Dr. Gary Slutkin. He treats violence as a public health crisis through a program called Cure Violence. His violence interrupters are making a difference around the world.
In the U.S., and it's gotten multiple evaluations. We have about 13 communities on the east coast of the U.S. and in Central America that have gone to zero in shootings and killings. We're getting 90% drops in Honduras, which, by the way, is also of interest. Yeah. We're working in Mexico and El Salvador and Honduras and Guatemala and also in the Caribbean and Trinidad. So the approach is different than what is usually considered, and the way of looking at how violence is spreading is the way that we look at all health epidemics. And so the method that we use is, and this is the missing piece, is having people who are in the communities themselves who can not only be aware that someone is upset or thinking or planning of doing something or post it on social media, but that there's a network of folks who can be called and then can interact with that person who is considering possibly doing an event such as these horrible events, and interact with them in a way, because they're trained, that they can slow this process of down so that they can hear what the person's complaints are. They can validate their complaints. They can buy time, cool them down, buy more time, and eventually shift their perspective on what they're doing so that it doesn't happen. And then we continue to be with them. They're not even to the point where we're ensuring that they're going on another path. This is called constructive shadowing, or babysitting is what the guys in the neighborhood call it. And so that these events don't happen, because a lot of times law enforcement, for example, is called, but they can't do anything because nothing has happened yet. Because the guy hasn't broken any laws and they're getting so many calls and they don't have time. But our guys have the time and have the training so that the events are prevented. And then there's a whole lot to say here. I don't want to take up all your time, but like, for example, the guy who did the Pulse shooting, he was followed by the FBI twice, once for 6 months, once for a year. And it's like watching someone, with tuberculosis get sicker and sicker, but you're not doing anything. Whereas, our workers, they would be interacting with that person and, changing his life course so that it doesn't happen.
Dr. Gary Slutkin, founder of Cure Violence. It's now spread throughout 25 states throughout the United States of America: Illinois, New York, Puerto Rico, Philadelphia, Baltimore, the list goes on, including countries around the world like Iraq, South Africa, and Syria. We all can do our part in stopping the violence. Stop killing each other, cease fire, spread love, freedom, and peace.